Anytime and anywhere, the fear of your life may suddenly come to you. You cannot delay the desperately dangerous situation. We will protect your life. Lifeguard, Nanung Tech. CPR Guide. If you find a collapsed patient, tap the shoulders of the patient lightly and check the consciousness. If the patient is unconscious, call EMS and request for an AED equipment around. After finding the chest compression point, press the chest 30 times at the speed of 100 times per minute into at least 5 centimeter depth. At that time, press the point with both elbows straight and being vertical to the patient's body. Press the chest 30 times at the speed of 100 times per minute into at least 4 centimeter depth with the hand in the case of infant less than 25 kilograms. After you secure the airway exactly as holding the patient's forehead with one hand and lifting the chin with the other hand, in the status covering the patient's nose completely and his entire mouth. Do artificial respiration twice by slowly blowing your breath, that the chest comes up for 1 second. When doing artificial respiration, keep your eyes on the patient's chest. Keep pressing the chest and doing artificial respiration until the rescue team comes. 5-Minute Miracle Heart Plus Detachable Type. Check whether the patient is conscious or not. If the patient is unconscious, request for help on EMS or 911 and for Heart Plus Automatic Defibrillator. Do CPR with 30-time chest compression and 2-time artificial respiration in turn. If Heart Plus arrives, turn on the power of it. Take off the patient's jacket and wipe out any water on the patient's body or remove the pollutant. If the pad adherence check light is turned on with the voice of pad adherence command, tear the electrode pad pouch open and take out the electrode pad. After connecting the connector of electrode pads to the cartridge and check the adhesive position, remove the white adhesive paper of an opened electrode pad. For adults, put the pad on the right chest and left side. And for infant, put it on the chest compression point and back. After putting the pads on, pass to ECG check light. If you are away from the patient and wait according to the voice instructions, automatic ECG check will be carried out. In case of a patient with arrhythmia, the equipment will be automatically carried out the high voltage charge. And this is the electric shock preparing process. So the electric shock button will flicker with the voice instruction for being away from the patient. Push the flickering electric shock button and give the shock to the patient. The energy for electric shock will be automatically discharged unless pushing the button within 20 seconds. After giving the electric shock, do CPR according to the instructions. In case of a patient without arrhythmia, do CPR immediately. After repeating chest compression and artificial respiration 5 times, Heart Plus analyzes the ECG again. In case of a patient with arrhythmia in this time after the second ECG analysis, pass to the preparation of electric shock and give it again. Do CPR according to the instructions. Repeat ECG check and CPR in the above order and keep going them until the rescue team arrives. Turn off the power of Heart Plus. Before and after using, check the product and cartridge. System self-test is periodically performed on the regular time. If you'd like self-test by yourself, simultaneously push the button for adults and children for over 1 second long.